Chair and Minister, here we go again in relation to it, and again it's a scandal that's given us cause to talk about nursing homes, and all the details of that scandal have been outlined, and I'm not going to outline them again, but it is actually bewildering that HIQA had a report on one of the homes, Benaven, in November, and it was compliant and substantially compliant. That in itself is frightening. But I just looked there to remember, because my memory is faulty, as to when in Galway we closed St Francis Nursing Home, and I went back. And on the streets of Galway in 2011, over a winter period, we gathered over 20-something thousand signatures begging the health executive not to close St Francis Nursing Home. They ignored the people of Galway, they ignored the signatures, and they closed it. We did manage to keep it open as a primary care centre, but I'm using that as an example. Around that time I travelled to Portlaoise as well, and they were closing a public nursing home there in Deputy Fleming's. I can't remember what happened with that, but we were joining forces. That's back in 10 and 11, where we said the writing was on the wall in relation to the closure of public nursing homes. And that started earlier with Fianna Fáil and the PD philosophy, which I've repeatedly said knew the price of everything and the value of nothing, and the mantra that private is best. And every single government policy went in then to ensure that private was best, not for care, but for profit making. And that's what happened. And then I've asked a number of questions in relation to how many private nursing homes have had to be taken over since 2020 alone. And I think I've counted up 11. So Wicklow, Kerry, Galway, Kerry, Cork, so on. So the private nursing homes get into trouble, and then the public system has to go in and send in actual staff on the ground in Galway, in Loughterard, in Galway City, into private for-profit companies who are unaccountable, and we send in staff. And this is ironic, Minister, because there's a nursing home in Carrow, which I've mentioned loads and loads of times, and they can't get staff. And they have 13 beds at any given time, somewhere between 10 and 15 beds, empty at any given time, I Greel or na Gaeltachta, and they say that there's no staff. And yet, when all of these private companies get into trouble, we seem to be able to send in staff, no problem, to take over them. And I'm not sure, have we learned anything, or what has been the cost of looking after the private companies that got into trouble. And we're all in receipt of, on the public accounts, which I won't read out, but correspondence that's absolutely harrowing arising from COVID, and how many died in nursing homes and how they were treated. And this is 2025, and they're still trying to get documents and appealing to us. So let's look at the percentages. It's not even 20% that's in public ownership. It's much less. We know from the Public Accounts Committee. So in that 20% and less, that's publicly owned nursing homes plus voluntary bodies, I think it's as low as 14 or 15%. Now, I know from Galway they have an excellent reputation. Merlin Park, St Francis Home when it was there. So I just despair sometimes at the forcefulness of a lobby group and governments that absolutely back up the market, when all of the facts tell you otherwise, when we put all our eggs, which is a very bad image really, when we just pursued one avenue and kept reducing public ownership of nursing homes till it's just... So if we were to learn anything from this, rather than listing out the scandals, perhaps we could have a change of policy from the government.